Listen all of you. Recording the patient history, recording the people history. What is happening in the civilian department? Other one is happening in the healthcare sector. Government of India, Tamil Nadu, used to collect vital information from us and from our family, that is patient history, that is history of the people, civilian history. The same thing is happening inside the hospital, right? The same civilian is having a health issue. When he reaches the hospital, he undergoes several treatment. Sometime it may be a simple problem, he might come out of the hospital within an hour, even within 10 minutes also. If it is going to be a common cold, after seeing or after detecting his common cold problem, using a stethoscope and eye and nose and mouth observation, doctor will issue him a simple cold drugs, right? Cold subsiding drugs. Sometimes it is severe, it may be due to virus, he may go for some antibacterial drug in order to subside the secondary infection by virus, secondary infection by bacteria, while the body is having viral infection. Okay? So when the viral infection is in the body, it will reduce immunity so that bacterial infection may add in our body. So that he will issue a simple drug and he will tell him to go within 10 days, in which there is no patient history is required. Just he will receive a prescription, he will be issued with the medication in the dispensing pharmacy department and he will leave. As per the direction given by the pharmacist or the doctor, he will take it, he will undergo or he will take the medication. But if he is a patient having a severe disease, for example, he is a paramedic or a nurse, you can keep in any way, right? A pharmacist, anyone, right? Or maybe a doctor, right? You are patient 1, patient 2. Okay? Patient 1, patient 2. He knows something about what they have taken for the last 1 week.
Yes.
Since I am meeting thousands and thousands of patients every day,
Yes.
right? I may not be remembering, and so I am recording on the prescription, right? What are the drugs are issued to Mr. A and Miss B, right? He is suffering from a kind of disease, an insect bite, right? And she is suffering from some kind of a long time fever of 4 days, 5 days, not subsiding even with the paracetamol. Such a problem here. So what I am doing is, I am calling him, I am checking him, I am seeing some bite marks on his skin. Probably they are too fanged. Either it should be a snake if it is larger. If the too fanged bite mark is small, it may be a centipede. Further, it is very small, it may be a mouse or rat bite. So first thing, I am putting him an injection. Tetanus toxide. Calculating his body weight. Heat. Right? Then I am asking him to wash his wound with the iodine solution. Okay? Or any kind of hydrogen peroxide solution in order to remove the debris as well as the bite mark containing microbes which were extracted from the teeth or fangs of insects. So it will lead to further infection. So I am washing it well. Then I am adding antibiotic and dressing it up. I am offering him for 3 days of antibiotic dose. Probably for insect bite, penicillin is very well.
Yes, sir.
Penicillin is very well. If penicillin is not available, you can go for tetracyclines also. They will also be very effective. Okay? But best one is penicillin. Any kind of penicillin or advanced penicillin you can go for. Okay? Or symptoms are not subsiding, you can go for cephalosporin diabetes also. So first I am providing you a basic amoxicillin tablet.
Yes.
Okay? And I am sending who? Right? He is more or less like not inpatient, outpatient. After treatment, gone away. This lady has come to my hospital. I am telling the nurse to provide this prescription, and I am asking this paramedic, tell him to go to medical shop and purchase the medicine, and tell the medical shop pharmacist to direct how to take the medication, when and where, before or after food.
Yes.
Okay?
Yes.
I am directing. Next, I am calling you. Right? What is the problem with that lady? So severe fever. I'm not able to stand up, I'm not even able to eat anything. Then I'm telling, when you have fever, you cannot eat anything properly because fever will have more than 40 degrees centigrade. Your body must have 98.4 Fahrenheit, around 33.33 to 34 degrees centigrade body temperature. When the fever comes, goes around to 101, 102, the body temperature will destroy the enzymes so that your digestion process will not take place, so that you cannot digest any food. Right? So that you have to go for some liquid, very light liquid diet. Right? Number one, that is my advice. Then I'm telling it's a kind of I'm drawing blood and I'm asking my paramedic to verify whether it's a typhoid or malaria or any other infection, bacterial infection. And he is reporting me it is none of this bacterial infection. But the temperature is not subsiding. I'm coming to my conclusion maybe a viral infection. So the viral fever. Viral fever, whether we are treating or not, around 7 days it will stay in our body. Then our immunoglobulin will start taking its course of action and it will kill all the virus. Automatically we will become immune.
Yes.
Immune, right? However, the 5 days we must protect our body from environmental conditions such as secondary viral infection. Secondary, not viral, bacterial infection. Whenever viral infection is taking place in our body, our immune system is compromised. Right? More or less, the immune system is the local places wherever the infection is compromised. The viral will be compromised in the immune system and thereby it will be fighting with our body for food and other things. Right? In that cases, if we are leaving it, automatically through bloodstream, whenever bacteria enters, it will also go and act on that. So secondary bacterial infection will start. So what I want to tell is for you for rescue medication, paracetamol 500 milligram.
Yes.
Okay? Twice a day or thrice a day after food. Huh? If fever is severe, take one more dose, thrice a day. Or if it is not severe, morning one, afternoon one, etc. Right? You take food after food. Food, the cells don't take any solid food, it will not digest for your viral fever condition as your temperature is high. Now I am asking you must take little rice, kanji or little rice water and grind it well. When only one half glass you drink, it will be easily digestible, right? Then you take medication, right? If you feel very sluggish, go for some glucose or some other treatment. Yes. Okay. Take off a spoon of glucose will be useful, right? But don't go for a solid food, it will affect your digestive system also. It will make you very bleak. So, then I'm telling you, you also go, right? Second time I'm calling. Second time I'm calling. You are having same fever, right? For you, snake bite is not even subsiding. Next day, what I have to do? I mean, nothing never going to be like this. What I have to do? I'm going for the patient history. Going for the patient history. What did you take yesterday? Food? What food you have taken? For snake bite, I have given external medication and I have provided you one antibiotic, right? Penicillin, ampicillin, I have given. Along with the ampicillin, B-complex also I provided. Have you taken all the medication? Have you taken all the medication? All the medication you have taken?
Are you taken all the medication?
I have given 3 doses now, man. 3 doses in the sense every 6 hours 1 dose. 1 hour day, after 1 hour day you are coming. So 3 doses completed?
It's not.
Completed. Now you show me the space where the bite mark happened. The bite mark is still there.
Yes, sir.
And redness is there. It's not closing, redness is there. Although dressing was done. Right? So your patient history now is you had been provided within the first day antibiotic and you have been advised to take normal food. There is no any food condition.
Yes, sir.
And you have been provided with another one. At least once or twice a day you must remove the bandage and you must make fresh bandage.
Yes, sir.
That you have done. After that also it is not. So I am asking the nurse or paramedic, I am ready to go for higher cephalosporin derivative.
Yes, sir.
Cephalosporin derivative. Okay. So cephalosporin derivative will have digestive tract related problem or probiotic one or B complex one added. Okay. Right. This is the second history now. Okay. You can take as usual good food. But don't take any food which is creating allergic or which is creating itching while taking. Right? For example, any food when you take is itching or then stop the happening. Okay? Right? Right?
Yes.
The patient history now twice recorded.
Yes, sir.
Patient history is now twice recorded.
Means
And for that, what about your fever? Fever subsided? Little bit or ऐसा है?
as it is बना रहा कि बुखार कम हो सकता है. सही है. बना हुआ.
Already.
नहीं सर.
Sir, reduce.
Fever is continuing.
Continuing reduce. Slightly reduce it, but continuing. Whenever you have to tell your pharmacist, you know you will ready. Whenever I take paracetamol, fever is controlling. When the paracetamol action is over, fever is again rising. It means the fever is controllable by paracetamol, not by antibiotic.
Yes, sir. Yes, sir.
So infection still, viral infection persists in the body. Okay. Now for you, we are going for higher antibiotic.
Yes, sir.
Why we are choosing antibiotic? The antibiotic is not going to kill virus infection or virus. There is no use. But now is the condition your immune system is compromised and fever is not relaxing in the sense your immune is still fighting with the virus. It's not at all dominating. So until it dominates, until it comes up with the domination of your immune system, I am providing you antibacterial drug so that it will prevent your body from other bacterial infection. Okay? So along with the provided drugs you take antibacterials also.
Yes, sir.
3 doses. Right? Then you also got cured. You also got cured.
Yes, sir.
Your business is over.
Yes, sir. Okay.
Your business is over. Now the second doctor. Wait.
Yes, sir.
Now he is coming with a new problem: severe stomach pain and diarrhea,
Yes, sir.
uncontrolled diarrhea. This lady is coming with another problem that my eyes are becoming orange and yellow.
Yes, sir.
And I feel very weak. Okay, I feel very weak and I'm not able to walk. And then this doctor. I said, okay, let us complete it. You should not go for you take this prescription, that prescription. No. We must first talk about the history of previous treatments.
Yes, sir. Yes, sir. Yes, sir.
Last week, last month, or nearby 2 months, have you met any doctor for the treatment of diseases?
Yes, sir.
Right? Then he will tell, yes sir, I took antibiotic. Right? Which antibiotic? This antibiotic, sir. This is the prescription.
Yes, sir.
Right? These are the food advice, sir. Now this prescription, then he will identify for this diarrhea that drug is not having any end of action.
Yes, sir.
No problem. Keep it. Now I am going to start a new treatment that will concentrate only on your stomach problem.
Yes, sir.
Yeah.
Yes, sir.
So history is needed. Without knowing what he has previously taken, he cannot immediately provide another medicine.
Yes, sir.
You understand now?
Yes, sir.
Sometime, if the remaining in his body's remaining side effect is existing, remaining for this action is going on within 1 week treatment, within the period of 1 week treatment, right?
Yes.
What will happen? Both will interact.
Yes, sir.
And this is the problem will come, right? Okay. Likewise, if this lady is coming with this problem
Is
viral fever doesn't have any connection with the weakness of the body, blood test conducted, her blood is having 11.5 hemoglobin instead of 14.
Yes, sir.
Okay, so she's having hemoglobinemia or anemia. So sir is recommending if she's
Some syrup of like
iron syrup, ferrous syrup, right? Calcium injection.
Yes, sir.
Everything will be provided. Apart from that, your food, you must take green leaf
Yes, sir.
daily. Along with apart from that, she will go for, if you are a non-vegetarian, you can go for our
Like us.
Maniral, they will say.
Sir, pomegranate and
Maniral, they will say in Tamil. Maniral. Okay?
minerals.
What is it?
That is Nagel, sir. It should be taken.
Maniral in Tamil. That one is called as blood organ. Organ which is containing blood, more blood. What is it? Liver. Spleen can be from goat.
Yes, sir.
This spleen can be applied for weekly twice if you take your
Yes, sir. Yes, sir.
okay hemoglobin content will come up to 14 automatically.
Yes.
Okay, so if you are non-vegetarian, you can go for that. For vegetarian daily, you take kira. Kira means full green vegetable.
Yes.
Apart from that, you will be providing iron tablets. You will be recommending iron tablets and iron syrup. Right?
Yes, sir. Yes, sir.
This is the treatment. Next mention. Then he has to tell patient history very important. While taking iron tablet, it should be taken half an hour after food intake.
Yes, sir.
If you take it empty stomach, or if you take after a long time of your food intake, it will create vomiting.
Yes, sir.
Understand? Indigestion problem. Yes. That you must tell them.
Yes, sir.
Right? This is called history.
Yes, sir.